we get to look at surgery, and this surgery is usually done for impingement syndrome. Okay, impingement around the shoulder. Okay, so this is a subacromial decompression. So if there's a compression, you want to release it. Okay, so subacromial decompression, we said that it's a surgical procedure and it's used to treat what? Shoulder impingement syndrome. Okay, so it involves removing or reshaping structures in the subacromial space. Okay, and this is, you are trying to relieve the pressure that is on the rotator cuff tendons, and you are trying to restore what? The ability for the person to be able to move the shoulder without any pain. Alright, so let's discuss it again. Subacromial impingement syndrome occurs when the rotator cuff tendons and subacromial bursal are compressed between the humeral head and the acromion. Okay, well, you could look at it, it's mainly at this place. Alright, so if this place is now coming up here, so that this space is now little, so it's compressing the structures there. So symptoms, there's a lot of pain when you try to lift your arm above your head. Okay, there's weakness of that region, and there's reduced range of motion, and you can also feel pain at night, you know. So causes is what? Structural narrowing of the subacromial space, like all those bone spurs. It could be naturally, like the shape of the acromial of the person. Also functional issues like the muscle balance, poor posture, repetitive overhead activities. You know, you can have the rotator cuff what? Tendinitis, or bursitis, or calcific what? Tendinitis. Okay, so subacromial decompression process, the goal is just to increase the space so that the structures that are between what? The acromion, you know, and the space down, they are actually free. So technique, we have the arthroscopic decompression. This one, they are using this what? Arthroscope, which they are making just very small holes to get in. The open one, they are making larger incisions, right? So open one, larger incisions. So steps, you try to remove the inflamed bursa, that's what? Bursectomy. You try to shave or reshape what? The acromion there, that's what? Acromioplasty, which is removal of bone spurs if present. So indication, that's if the person has tried to treat the shoulder pain for more than 6 months without any success, right? Okay, so maybe there's also a functional limitation and it's affecting the person's work or sports or daily activities. Alright, then you actually need to go in for the surgery.